Hello and welcome, everybody. Welcome to those joining us live today and to those listening to us afterwards. We're very pleased to have you with us over the next hour during this very special opening event of the new program, Transforming Vaccination globally, regionally, and nationally for 2021, accelerating equity, access, and sustainability through policy development and implementation. I'd like to begin by briefly introducing myself. My name is Lina Badr. I'm the FIP lead for Workforce Transformation and Development, as well as the lead for FIP's Transforming Vaccination program this year. I also lead programs on equity and sustainability at FIP, making this program extra special to my heart. I'd like to hand over to my co-moderator, Farah, who will introduce yourself. Farah.
Thank you, Lina, and hello, everyone. Welcome to this webinar brought to you by FIP. I would also like to warmly welcome our guests and our speakers who I'll shortly introduce. My name is Farah Aqqad, and I'm going to co-moderate today's session. My role within FIP is the regional engagement and the project coordinator. And I'm also the program coordinator for the Transforming Vaccination globally and regionally program. We are pleased to be delivering the opening event, the first episode in the Transforming Vaccination Program 2021. If we can go next, I'd like to start with some announcements. Please note that this event will be recorded, live streamed on FIP's YouTube channel and profile. It will be freely available on our website via www.fip.org. To all those listening, please feel free to send your questions throughout the question box. Share with us your name and where you're watching us from, and we will be picking up your questions throughout today's session. Feedback about the event are welcomed at webinars@fip.org. And if you're not already, we do encourage you to become an FIP member. If we can go next, we will open the event by highlighting the agenda items. And I'll give the floor back to Lina to lead us through this. Lina, floor is yours.
Thank you very much, Farah. We just want to let you know what we're doing with you over the next hour. First, we'd like to recap Transforming Vaccination 2020. That will help us really describe the road leading us to 2021. We'd like to also reflect together on emerging issues since then, especially as we live through the pandemic, and how this has implications for what we're doing together today. We'd like to also build and describe the rationale for why we're focusing on equity, access, and sustainability this year as our Transforming Vaccination program. We'd like to discuss the regional and global needs and priorities as well. And resetting Transforming Vaccination, we'd like to describe what this year's program really entails and what its key outcomes are. Finally, we'd like to invite you to our program's next events and encourage you to register, but we'll get to that a little bit later. We'd just like to very briefly run through today's panelists, and Farah will help me do that.
Thank you, Lina. So our first speaker today is Dr. Catherine Duggan, who's the Chief Executive Officer at FIP. Gonzalo Sosa Pinto, who's the FIP lead for practice development and transformation. And then representing our regions, we have Jisoo Malada, who's the executive committee member at the Southeast Asian Regional Pharmaceutical Forum. Next, we have Dr. Nadia Al-Mazroui, who's the president of the Eastern Mediterranean Regional Pharmaceutical Forum. John Jackson, the president of the Western Pacific Regional Pharmaceutical Forum. And last but not least, Prosper Hieg, who's the president of the African Pharmaceutical Forum. Welcome, colleagues, and we're looking forward to hearing your inputs today. But before we begin with our first speaker, let us hear a message from FIP's president, Dominique Jordan, and I'll ask Lina to start the video now.
My name is Dominique Jordan, and I am the president of the International Pharmaceutical Federation. I am delighted to be here with you today. In partnership with Pfizer in 2020, FIP launched the first digital program of its kind, Transforming Vaccinations globally and regionally, that addresses the essential role pharmacies play in saving the lives of millions through the provision of vaccines. The program is a three-part series, each consisting of 8 online events. In the first series, the needs of pharmaceutical science, workforce, and practice to transform vaccinations were identified, such as increasing accessibility to facilities in practice to deliver vaccines. Other needs include evolving pharmacist qualifications, training, and education on the matter, and addressing barriers such as vaccine misinformation and disinformation. In the second part of the series, transformative actions were set in alignment with the needs identified in the first part. In the last part of the series, the focus is on the needs of each of the 6 global regions. Best practice on vaccinations in some countries were highlighted to help other countries follow. Regional needs assessment, country-level metrics to monitor progress, and action plans were discussed along with the barriers and challenges that may be encountered to transform vaccination in each region. The program resulted in the signing of a commitment to action on vaccination in pharmacy by FIP and other member organizations to transform vaccinations regionally and globally. Of FIP's 21 development goals, 17 align with the goals of the 2020 program. However, 3 goals have shown to be grounded in every part of the program. Goal 10, equity and equality. Goal 18, access to medicines and services. And Goal 21, sustainability in pharmacy. We cannot transform vaccinations regionally and globally without incorporating these 3 concepts in every part of the program. In 2021, FIP is renewing its partnership with Pfizer and is launching its second program that focuses more on the equity and sustainability of vaccinations. Building on the outcomes of the 2020 program, the FIP 2021 digital program focuses on supporting FIP members in accelerating programs of equity, access, and sustainability of vaccinations through policy development and implementation. The 12 events explore equity in vaccination across the different angles of age, gender, literacy and education, and interprofessional unity and collaboration. Regional roundtables will discuss and identify priorities for sustainable access to vaccinations through pharmacies around the world. The program will result in a FIP commitment to accelerate equity, access, and sustainability through policy development and implementation, as well as a special policy collection capturing the outcomes of this transformation program.
I'd like to thank our president for that message, and through the next hour we'll be elaborating on some of what he said, especially with regards to describing this year's program and how we've come to it. But first, we'd like to recap 2020. So I'd like to invite Gonzalo to the floor, please.
Hello, Lina and Farah and everyone. And again, thank you for the opportunity to participate in this event. As Lina was suggesting, and to build and expand on what President Jourdain just presented as a brief summary of last year's series of events on the program of transforming vaccination globally and regionally in 2020. Before we enter this year's program, let's just recap very briefly what we did and what the topics that we covered with last year's program, what we achieved, and how that builds a foundation for this year's program. Can I have the next slide? Yeah, thank you. So as you may remember, the program was launched last year on World Pharmacists Day, which was an excellent opportunity to link it to such an important date for our profession and to highlight the role that the pharmacist can have in vaccination strategies, in driving vaccination coverage and improving vaccination uptake around the world, especially during such a challenging time of the current pandemic. So the whole series took place between September and December 2020 and included three series or three blocks of events of 8 events each, focusing on different parts, on different topics, on the needs, on the goals, let's say, and the mechanisms, and then again on the commitments and the actions to take and the resources that we have to develop them. So this was the first digital transformation outcome-based online program that FIP delivered. And that means that it was a structured program to lead to concrete outcomes, and it was underpinned by the FIP development goals that were launched just before the start of this series of events in September 2020. And the outcomes, of course, were, we will comment them towards the end, but the main outcome was a commitment to action towards on the last session. Could I have the next slide, please? Again, this was a very timely event, as you may remember, because this was the time when vaccines for COVID-19 were entering the last phases of publishing results on safety and efficacy. They were going through the regulation and the registration around the world, and countries were preparing for delivering mass immunization strategies around the world. So it was very timely to raise the awareness of policymakers, of our colleagues around the world, of how pharmacists can play an important role in the vaccination space, and particularly also linked to COVID-19. So for the first series, identifying transformation needs included 8 events that covered the needs around practice, pharmacy practice, science, and workforce and education. So in terms of pharmacy practice, we aim to identify needs, for example, around the professional services that pharmacists can deliver, and the regulatory changes that need to be in place as well, the requirements for delivering these services, how pharmacists can participate in driving vaccination coverage and uptake. But this, of course, only makes sense if the pharmaceutical sciences are part of the discussion and really bring into the debate the elements of vaccine development and vaccine safety, and how, for example, new technologies for vaccines were being delivered and needed to be communicated, and also all the issues on the aspects related to vaccine efficacy and vaccine safety that needed to be communicated around the world. So translating the science into messages that can be communicated and converted into practice around the world, especially at a time when there was so much misinformation and fake news and anti-vaccine movements that needed to be addressed and explained clearly and based on the evidence. And again, the needs in terms of education and workforce development, what skills, what knowledge, what competencies need to be in place for pharmacists to deliver these services and really play this important role in the vaccination space. Next slide, please. So with series 2, after identifying the needs, we moved on into identifying the actions that were needed. What are the goals that need to guide our action and to guide our strategies to achieve this strategy and this important role by pharmacists in the vaccination space? So this part was really based and linked very overtly to the FIP development goals. And as President Jordan mentioned, vaccination is really linked to 17 out of the 21 goals very clearly. And therefore, this part of the program was very based and very directly linked to exploring how vaccination is linked to several of the goals. And especially we focused on the 8 goals where vaccination plays a more central role. And I would like to just go through these goals very quickly with you, because to highlight the relevance of the specific goals. So this included an event that dealt with goal 10 and also goal 18, that deal with equity and equality in access to vaccination, but also the goal 18 on access to medicines, devices and services. So there's a clear need to address issues of access and equity to vaccines and to vaccination services around the world, not only across countries, but within countries, targeting populations that need the most vaccines, populations that are hard to reach, issues of literacy, so addressing all those questions. Then we addressed issues of policy development around goal 13 and how policy needs to be transformed and the regulation of the profession needs to be transformed to expand the role of pharmacists and the scope of practice of pharmacists to adopt such roles. We also focused on a different event on goal 19, dealing with patient safety. And vaccines contribute to patient safety, but there's also concerns about patient safety. Some of them are very legitimate. People are curious and interested and concerned about how vaccines work, how safe they are for their elderly family members, for their children. So we play a role in explaining this, but there's also elements of patient safety in administering vaccines as well, so that need to be considered. And again, we focused then on goal 7, advancing integrated services. That had to do precisely on the integration across different health professions, integration between pharmacies and health systems. We focused on goal 4, advancing and specialist development, so the training that is required and the CPD strategies and undergraduate level to deliver these services. And finally, we focused on those goals that are more overtly linked to vaccination, which include communicable diseases, and of course their relationship to vaccines, and many of them being vaccine preventable diseases, and goal 17 on antimicrobial stewardship and how vaccines are a powerful tool to curb and fight antimicrobial resistance. And in the next slide, please, we move on to the third part of the program, series 3, which was committing to transformation. In this series, we explored the regional roadmaps and the regional priorities and the resources that are in place to deliver these roles, what is required, what best practices are there from countries in the region that can inspire change in other countries in the region. So we really organized a series of regional events with leaders from various professional organizations to help raise awareness and mobilize them and engage them in this commitment to transformation of the role of pharmacists in the vaccination space. So this 3 series led on to a final commitment to action that was signed by the president and the CEO of FIP. And we invited, maybe in the next slide. Exactly. So we initiated this process of mobilizing our member organizations and other stakeholders to sign and support and endorse this commitment to action by that includes 17 actions, concrete actions to address this important role that pharmacists can play, and how pharmacists are ready and willing to participate in mass immunization strategies, in prevention and preparedness for the pandemic, not only for this pandemic, but also for future pandemics. So we need to join efforts with our colleagues in other health professions to really achieve the highest possible vaccination coverage rates in all regions and across all population sectors. We do have a number of resources in FIP that are there to be used, toolkits, letters of support addressed at Ministers of Health, data from in our global pharmaceutical observatory and the surveys we have conducted. So all these resources are there together with this commitment to action to support the work of our member organizations to advance the pharmacy's role in vaccination. And I believe this brings us to the end of my presentation. So thank you very much for the opportunity.
Thank you so much, Gonzalo, for summarizing the program and outcomes on behalf of the entire team last year. And I'd like to just reiterate what Gonzalo said. We are building on success. We are building on lots of work over the years that FIP has built. You can find links to these resources on our website, but we have also summarized the entire outcomes of 2020's program in a digital collection that you can find online on transformingvaccination.fip.org/collection. The collection captures all of the key outcomes of the program and is intended to support the implementation and progression of the commitment, and is really made for our members to help them utilize the goals and apply the mechanisms to transform vaccination in their country. So we do hope this collection continues to help you, our members, progress vaccination transformation journeys in your nations and regions as well. We'd like to take this opportunity, as we always do at FIP in terms of building on success, thank everybody who was involved last year, including our speakers, facilitators, participants who attended, stakeholders, simply everybody who was involved, but especially the team who was involved in developing last year's program, including who we have, some of which we have today. Catherine, we have Carleen was with us last year, Farah and Gonzalo. We'd also like to take this opportunity to thank the events, marketing and communications team who continue to work with us, of course, today and this year with this year's program. Corolla, Mila, Daria, Ali, Lina, thank you very much. I'd like to move us along to the next part and invite our CEO, Catherine Duggan, to tell us a little bit more and share some of her reflections on issues that have emerged since and the rationale really for why we're focusing on equity, access and sustainability this year. Catherine, the floor is yours. Thank you for joining.
Thanks so much, Lina, and thank you, Gonzo, for providing us with such a good overview of last year's programme. So I wanted to spend a few moments, colleagues, with you to place this into context for us all. First click, please. We're in our second year of a global pandemic, and each of our countries has a different story, as do each of us as individuals. And each country is undergoing a different journey, both in terms of responding to the pandemic and adapting to life within a pandemic. What we know across countries and regions is that we have shown such innovation, flexibility and adaptability, but we've also seen the pain of colleagues and loved ones dealing with loss and heartache. Next click. Not to put a dampener on it, we've seen examples of greatness, scientific endeavour and science and innovation shining through. To develop vaccines in record times, we've seen innovations and collaborations in drug discovery, drug development, drug delivery, repurposing of existing drugs, as well as the identification of new treatments, with monoclonal antibodies being found yesterday to have an active impact. Healthcare professionals who have ceaselessly cared for patients and the public, our own profession is second to none, are also examples of greatness. However, we've also seen signs of weakness in our systems. The frailties in our communities have been further exposed across age, gender, comorbidities, income levels, jobs, etc. And we've seen an increased burden on our health workforce as they live with the pandemic, work within the pandemic, and face the huge inevitability of unmet care in like an iceberg beneath the COVID tip. Our third picture on this screen shows a patient getting a vaccine. Now, colleagues, we have vaccine rollout globally, but we can see such inequity. Some communities have the majority of their populations with 2 vaccines. Some communities have nigh on nobody with 1 vaccine. There are clear issues around shortages and access, questions about concerns to do with equitable distribution around the world. And we saw the G7 consider this last week. Vaccines are in our line of sight, of course, but again, from the tip of the iceberg, we can see shortages in many other drugs and essential therapies as well. These are really big issues for our future, colleagues. The sustainability of vaccines, vaccine services in the midst of these shortages and equity issues. We can use COVID to shine a light on these issues and then think about them more widely as well. Next slide, please. So with this slide, I'd just like to emphasize 3 main points. The first is that FIP continues to advocate for the pharmacy-based vaccination services. This builds on a decade of work, including, but not limited to, last year's programme, as we've recently heard, and how we're going to use the FIP development goals launched last September to support change, taking account of each of our nations and regions' needs. We have seen pharmacists rise to the challenge and play a key role in delivering vaccinations, not only to the patients, but also to health workers. And of course, we see variations around the world. Not all the countries have the legislation to support these roles, but FIP can help where we are needed. Because of accessibility to communities, the third point I want to make is that we are very visible within our communities, and pharmacy should be at the heart of these discussions around equity, access, and sustainability, not only of COVID vaccines, but all vaccinations. Next slide, please. So, colleagues, these are three very ambitious goals. In pharmacy, many of our other development goals have direct and immediate applicability to our priorities and immediate job roles. For example, patient-centred care, academic capacity, antimicrobial stewardship. However, we know access is at the heart of the FIP vision, and therefore becomes the home of many of the other development goals. Likewise, sustainability is not an easy one to pin down, with lots under its scope, as with equity and equality. These goals are not solely defined to pharmacy, and as such can be difficult to contend with. But as we expanded our pharmaceutical workforce development goals last year and developed the new development goals during the year of the pandemic, it became completely apparent that patient care and public health are only achievable if we also focus on sustainability and equity alongside access. I mentioned earlier that COVID has highlighted for all of us that sustainability and equity now grow in prominence and importance. Hence, the policy themes behind our Transforming Vaccination programme #2 for 2021. If pharmacy is to play our role in universal health coverage, we too must consider the sustainability of our workforce, sustainability of services and their provision, alongside wider issues on the environment, including the impact of air pollution on our populations and how we manage waste medicines. But those are not in isolation of issues of equity and equality, not just for our profession, but for our patients and the public we serve. That's why it's important for us to look at these three areas in more detail. Next slide, please. So it's really important that we look at the three mechanisms around workforce, education, practice and science, around equity and equality. I'll take you through these very briefly. For the workforce, we need clear strategies for addressing equity and diversity, inequalities in the pharmaceutical workforce development, continued education and training, and career progression opportunities. In the areas of vaccination service delivery, it's very important for us as a profession to ensure equity of access for all our workforces. This leads into practice, where we need clear strategies for equity and diversity in vaccination service delivery. Service access and service impact needs to be measured so that all people have access to vaccination services and all suitably qualified pharmacists are enabled to contribute to vaccine delivery, despite the fact we may see differences between nations. Finally, equity and global capacity of pharmaceutical sciences training, research infrastructure, the development and manufacturing capabilities is a more hot topic than ever before as we look at the inequity of vaccine manufacturing across the world. And evidence-based regulatory oversight in the development and implementation of pharmacist-delivered vaccination services is more key than ever. Next slide, please. Taking a spotlight then onto the access to medicines goal, #18, we need strategies in place to widen access to vaccinations through pharmacist-delivered vaccination services, utilising a responsive, capable, available and well-distributed pharmaceutical workforce. From a practice perspective, we need systems in place to optimise access to vaccines and pharmacist vaccination services through appropriate supply chains, quality standards, self-care and prevention services and affordability, as well as fair pricing policies. We urge you to listen to some of our development goal events around this very issue. From a science perspective, we need access to innovative science and information, new and innovative therapies, new delivery, manufacturing processes that enhance and complement pharmacist-delivered vaccination processes and services. Next slide, please. Let's take a little look then at sustainability in pharmacy from a workforce perspective. We need strategies and systems in place that utilise the workforce to enhance sustainable pharmacist-delivered vaccination services. It's not good enough, colleagues, for us to deliver a good service for a short period of time and then withdraw it from our communities. It needs to be sustainable. From a practice perspective, policies, regulations and strategies need to ensure the sustainability of the environment, minimise the impact of vaccination services. Appropriate mechanisms need to be in place to ensure the sustainability of pharmacist-delivered vaccination services through appropriate remuneration models. Again, I urge you to have a little look at our development goals series as well, where these are explored in more depth. And finally, from a scientific perspective, we need strategies and policies in place to maintain consistent supply of vaccinations throughout life cycle while limiting negative consequences to the environment. Thank you so much. I'm going to hand back to Lina now.
Thank you very much, Catherine, for that context and also spotlighting the key issues emerging last year that concern these three goals, which we focus on this year. We're moving along through our program today, and we'd like to move on to our regional roundtable discussion today to discuss regional and global needs and priorities. For this part, I'll ask Farah to facilitate this discussion. Farah, the floor is yours.
Thank you, Lina. So we will start with our global roundtable and our regional presentations to tell us today about the regional needs and the priorities that were identified to transform vaccination globally, regionally, and nationally. We would like to ask our speakers to highlight the regional priorities around vaccination and also why equity and sustainability and access are important regionally. So transforming vaccination from a true regional perspective. We'll start with the first region, Southeast Asia. Allow me to start by warmly welcoming Jisoo Malada, who's the Executive Committee member in the Southeast Asian Regional Pharmaceutical Forum. Jisoo Malada, the floor is yours.
Hello everyone, thank you Farah. I am Dr. Sumalata, who is Executive Committee member of Southeast Asian Region Pharmaceutical Forum. At the outset, I would like to thank Farah, Lina, and President Dominique and Catherine for giving the opportunity. And I am delighted to be a panelist in this Transforming Vaccination. Especially, I want to focus on how the transforming of vaccination happening in India. India is, as you all of you know, it is a very populous country with a population of around 1390 million. The COVID-19, this vaccination program was planned systematically by Government of India and is built in accordance with the WHO guidelines, taking into consideration the scientific and epidemiological evidence-based practices, whereby they have given priority to the healthcare professionals, especially all the frontline workers, as well as protecting the vulnerable population groups. They have planned in an excellent way. As a part of development of this vaccination program, our Government of India has constituted various expert groups in order to encourage domestic research and development of drugs, to formulate comprehensive action plan for vaccine administration, and to utilize technology to make vaccine program in a transparent way. For this purpose, Government of India, in April 2020, they have constituted a task force for focusing research on corona vaccine, and later in August 2020, they have constituted National Expert Group on Vaccine Administration, and in recently January 2021, a new empowered group on vaccination administration was considered by Government of India. Following this action plan, around 46.8 nearly million people, which accounts for 3.4% of the total population, are fully vaccinated, and 20 million people people have taken at least one dose, which constitute 14.8% of our Indian population. Indian vaccination strategy has hined almost entirely on COVID Shield, which is an AstraZeneca product, and to an extent a Covaxin, a product of India, which is manufactured by Bharat Biotech. As an Indian grapples with a vaccine shortage, another vaccine, Sputnik V, was formally approved by the Control General of India under emergency use authorization. India has explored 60 million doses of Covaxin till now to almost 95 countries of the world. Under this vaccination program, initially 100% of vaccine doses were procured by Government of India and were provided for free of cost to state government. In order to increase the pace of vaccination, enlisted private hospitals were also allowed to participate, where the individuals can get vaccinated at a prescribed rate. But according to the latest guidelines, which is given by Government of India, so they have procured 75% of vaccines being produced in the country and will be provided free of cost to all the governments and union territories, and which will be administered to the citizens as per the priority order, like first healthcare workers, then frontline workers, then citizens more than 45 years of age, then citizens whose second dose has become due, and the citizens 18 years and above. So this is going to be a big challenge for India because of the huge population. The remaining 25% of vaccines are set aside for procurement by the private hospitals for paying basis. And at the same way, India has developed a new app like CoWIN platform, which provides every citizen the facility of conventionally and safely pre-booking of this vaccination appointments. All these revised guidelines will come into effect from 21st June 2021. In spite of all these plans that are executed for vaccination drive, there is a lacuna exists in the issue of number of vaccinators. There is a wide gap pertaining to the COVID vaccination drive and healthcare providers is the vaccinators, and that can be bridged with the help of pharmacists, especially by engaging and providing training to the community pharmacists who are valuable assets in expanding the vaccination pathways. The same was addressed and written by Dr. Harshvardhan, Union Minister for Health and Family Welfare, Government of India, regarding inclusion of pharmacists in COVID-19 immunization program. Under the dynamic guidance of Dr. T.V. Narayana, President, Indian Pharmaceutical Association, and Dr. Rao Adlamodi, Secretary, Seer Farm Forum, has made a representation regarding the shortage of human resources who are well-trained pharmacists and established advocates, educators, as well as qualified providers of vaccination, which have a significant role to play in promoting and supporting the government in COVID-19 vaccination drive. In addition to administering the vaccine, pharmacists can identify, monitor, and document any adverse events that may occur post-vaccination and play a vital role in pharmacovigilance program of India. In many other developed countries, like pharmacists are participating as immunization providers. Even in India, pharmacists have played an important role in vaccination process. In the past, during National Tuberculosis Control Program in 2012-13, an Indian Pharmaceutical Association in collaboration with Ministry of Health and Family Welfare have engaged community pharmacists by providing training for DOTS TB program. And our Vice President of FIP, Manjari Garat, has also involved actively in this program. In the same manner, in order to help the government, Indian Pharmaceutical Association has framed a 2-week training module which is designed under FIP as a guiding organization. The major objective of these training modules is an endeavor to understand global regulatory requirements along with Indian context. Pharmacists are one of the most trusted healthcare professionals and are dispersed throughout the healthcare system across various practice settings. They are ideal for their role as they are already established in their competency for many aspects related to medication management, such as taking medication histories, counseling, and management, and managing medication-related adverse effects, all these things. I would like to congratulate FIP for conducting such kind of transformation programs and vaccination, Especially my special thanks to the President, Dominique, and Secretary Catherine for conducting such kind of events along with their crew and team support. Thank you everyone for giving me the opportunity and expressing the views. Over to Farah.
Thank you so much, Dr. Suma, for this summary in India. So colleagues, for more information about Southeast Asian inputs and for a regional summary about the Southeast Asians inputs in transforming vaccination, please visit the collection. I'd like us to now move to our next region, Africa. And for that, I'd like to welcome Prosper Hyag, who's the president of the African Pharmaceutical Forum. Prosper, the floor is yours.
Thank you, Farah. Thank you to FIP for the organization of this webinar for Writing Africa. First of all, I want to tell you some personal experience that I had a few weeks ago. I went to vaccinate. I got my first doses 3 weeks ago. And after that, I had the second dose. All the people, all the workers, the health workers were there, were pharmacists, young pharmacists, which means that more and more pharmacists are involved in the process of vaccination in our country, more and more. And I was very delighted to see these young pharmacists working on vaccination. But the situation of Africa is very, very, very tough, very difficult. Only 2% of the population of the continent has received a first dose, which means that for a population of 1.3 billion of people, the needs are very important. WHO has launched the COVAX vaccine program to provide vaccines to the continent. But the number of doses was only 22,000 of doses for 43 countries. And there was also 35 millions provided by bilateral cooperations. WHO says that to increase the number of people vaccinated, we need 600 million of doses until the end of the year to have 20% of the continent or the population of the continent to be vaccinated. The main vaccine that we received were coming from AstraZeneca through the COVAX initiative, but we had also other vaccines, Johnson & Johnson, Chinese vaccines, Sinovac and Sputnik. For me, the problem of equity and access to vaccine is the major one for our continent. We cannot continue receiving vaccines and not thinking about production of vaccines in our continent. That is why the initiative taken by CDC Africa for African Union to produce vaccines in Africa should be accelerated and encouraged. This is a way of getting vaccines in our continent. The role of pharmacists. In this period, we have advocated a lot to integrate pharmacists in the process of vaccination, the health programs. This has given small results in some countries, and more pharmacists are involved, are integrated. But the number of pharmacists integrated in vaccination is still very low. It had to be improved, encouraged. G7 countries have decided to give 1 billion of doses to poor countries, mainly Africa. I think this initiative of rich and big countries should be followed by FIP to see the effectiveness of the distribution of this donation decided last week in England. On the other hand, we have a problem of workforce transformation. We have to change our program in our academy to have more clinical pharmacy in universities. This is also a way to contribute to the amelioration of the practice in the future by putting more effort to clinical pharmacy in academia, in pharmacy school. These actions should continue. My recommendation are three. We should continue advocacy, follow the initiative of developed countries, and the initiative of manufacturing African vaccines in Africa for the production of vaccines as the African Union is planning. The aim in the future is to have more and more African vaccinated, maybe to reach the level of 20% at the end of this year. This is what I wanted to share with you, and to thank you for giving me the floor of speaking on behalf of the continent. Thank you.
Thank you so much, Prosper. If we can go next. In our next region, we will explore the Eastern Mediterranean region. And for that, I will invite Dr. Nadia Mazroui, who is the president of the Eastern Mediterranean Regional Pharmaceutical Forum. Dr. Nadia, the floor is yours.
Thank you very much, Farah. Thank you, everyone. Thank you, President Dominique, and all the FIP members who work for allowing me and for giving me this opportunity to express also and give an really an idea about also our Mediterranean region's needs and priorities to identify the transfer on the regional way to transfer vaccination. Mainly in our region, in UAE, for example, and in the Gulf region, we especially from UAE, we have vaccinated almost more than 70 to 80% of the population, and I think in the region, in the Gulf region, it is like that. But there is a variation of vaccination services delivery all over the EMRO region, the EMA region. So I think still we have to ensure that according for the transforming the vaccination in our region, we need to ensure also an undergraduate courses, including vaccination training. This is one of the things, and we should also provide post graduate training for vaccination for the region. And also we need development of guidelines and framework for vaccine delivery for all type of vaccines, especially to make a setting in the community pharmacy, also to re-accreditation, to perform a logistic also approach, and also to check the cold chain delivery of vaccines services. Lobbying also for decision makers is a critical activity Also, it should be combined with development of a training, guidelines, and framework of vaccine delivery to ensure that the decision maker can also see the evidence of pharmacists being qualified to deliver the vaccination. International organizations such as WHO, UNICEF, and the FIP, they are really greeting, especially the FIP. We thank you very much for leading this transformation in vaccination services through pharmacists. So we provide significant, they provide significant support also to the lobbying role of local organization. We have also still some challenges experienced in this in the transforming vaccination of for pharmacies, which can be classified as attitudinal barriers from other healthcare workers who currently provide vaccination, especially through financial factors play a big role in that. The lesson learned really from the learned whilst transforming vaccination for pharmacists, that the development of pharmacists capacity should be developed prior to or during the lobbying process, so that the pharmacist capacity to vaccinate exists and being developed at the same time that the legislation and regulation empower them to act. We noticed that during the coronavirus that there is really a big need for the involvement of pharmacists also as a healthcare expert in vaccination process services. So the key vaccination related legislation enablers and barriers emerging in the region, we found that the primary legislation enabler are those that recognize pharmacists as a vaccinator under the law. And that's what we need to emphasize, to concentrate in it. It is a big issue for us. Other legislation factors include laws that control the distribution and the funding of vaccine, ensuring these do not prevent pharmacists from participating in this issue. We found that implementation of the vaccinations services, it should be done in a quicker way, like in this time as we are in badly need by the corona vaccinations, by the COVID vaccination process is available, and it is a big opportunities also for us. For equity, access, and sustainability of the process, it should be affecting the pharmacists delivering vaccination services as a whole. And I think that the variation between the countries, especially in the AMR, some people they have a low number of vaccinators or pharmacists to be involved. We found that in certain areas like Pakistan, Saudi Arabia, we have also in UAE, we found that there is a big role and there is a big evolving of pharmacists in the vaccination process recently. And thank you very much really for, I would like to thank the FIP, and especially to allowing me and giving me these opportunities to talk about the AMR as a whole for the vaccination process. And thank you for also, and I'd like also to congratulate the FIP that for the leading this transformation and vaccination process. Thank you very much.
Thank you so much, Dr. Nadia, for this comprehensive regional summary. I'd like to note to our colleagues that I'm sharing these regional outcomes using the chat box, and I will be sharing some links for your reference. To note, the slides will be uploaded after each event on the website. If we can go next, our next region will explore the Western Pacific, and we have John Jackson, who's the president of the Western Pacific Pharmaceutical Forum. Unfortunately, John was not able to join us live today, but he has shared with us an important video to share some reflections. Thank you, John, for this important contribution and for the reflections that you've shared with us.
Good evening. As President of the Western Pacific Pharmaceutical Forum, I want to take a regional perspective in my presentation, but where appropriate, I'll illustrate using my own experience in Australia. Vaccination rates are short of what we hope for in many countries in the Western Pacific region. The level of engagement of pharmacists in vaccination is variable, and we can do much as a profession to foster greater uptake of vaccination, including vaccination of more people, vaccination against more diseases, and vaccination over a person's life course rather than just a one-off event. This includes pharmacists being directly engaged in the administration of vaccines. While each country in the region starts from a different position, faces different diseases, has a different legislative framework, and different resources at their disposal, the approach to pharmacist engagement in vaccination is fairly common across all countries. In addressing today's issues of equity, access and sustainability of vaccinations through policy development and implementation, I want to present a systematic and staged approach for pharmacists in vaccination. As we know, vaccination provides a personal benefit to the individual being vaccinated, plus a wider public health benefit through herd immunity. However, if many members of our communities cannot be vaccinated due to cost or poor access to vaccination sites, then the personal benefit will be limited to the few who can afford to be vaccinated. Community-wide protection will not be achieved, and this is inequitable. So, how are pharmacists relevant to this issue of equity? Being accessible and a highly trusted health professional with expertise in medicines, we can assist governments in boosting vaccination rates by establishing vaccination services in our pharmacies, whether by employing nurse vaccinators or by becoming trained vaccinators ourselves. How do we establish a pharmacy as a vaccination point? First, assemble evidence, including risk-benefit analysis and cost-effectiveness analysis of vaccination in pharmacy. Second, based on this evidence, push for policies that enable and support vaccination in pharmacies. Third, use public health messaging to foster public acceptance of pharmacy-based vaccination. And finally, train our workforce so that pharmacy-based vaccination can be implemented and become a reality. Uptake, of course, will depend on affordability, which will be influenced by the existence of subsidies and out-of-pocket costs. It's short-sighted for regulators and funders to not use pharmacies to create more vaccination locations, because not only does vaccination provide community-wide benefit, it also delivers strong positive economic returns, with the initial cost of vaccination outweighed by the savings as a result of avoided future health costs. Finally, I was asked to address how the various parts of the profession can work together to develop the role of pharmacists in vaccination. Academic pharmacists need to conduct implementation studies using a vaccine to a common local disease to demonstrate safety and efficacy of vaccination in pharmacies. In Australia, this occurred in 2014 using influenza vaccine. It will be different in other countries. Once competence and safety are demonstrated with one vaccine, others can be added to the program. Professional bodies need to lobby for regulatory change to allow pharmacists to administer vaccines without a prescriber's instruction, also to develop the necessary competency standards and establish training programs. And this is where regional collaboration facilitated by the Western Pacific Pharmaceutical Forum can be of assistance. Proprietors need to develop business models and refit pharmacies to include private consulting rooms and waiting areas for pre- and post-vaccination. Along with professional bodies, the proprietors need to lobby for funding agencies to support pharmacy-based vaccination. And finally, pharmacists need to become credentialed as vaccinators. Over half of all Australian pharmacists have now done so. Our basic education as pharmacists covers most of the theory a vaccinator requires, so what we need to focus on is becoming proficient in vaccination techniques. We currently have a great opportunity to implement this strategy. The need to roll out COVID-19 vaccination is placing a significant demand on existing credentialed vaccinators. This creates the opportunity for pharmacists to argue they should be credentialed as vaccinators to either backfill gaps and maintain existing vaccination programs, or even to be involved in COVID-19 vaccination. Thank you for your attention. I was sorry not to be able to be with you in person to answer questions. Thank you. Goodbye.
So thank you again to John Jackson for sharing this video with us. I'd like to note that as our CEO confirmed in the chat box, we want to confirm that from the next event, FIP will offer certificates to any of you who wish to have them. And unfortunately for this particular event, it's just a review and it's just a recap event, so it doesn't have any associated certificate. But we do hope that this is a great benefit to some of you. For our last two regions, we have Europe. Unfortunately, our facilitator from last year couldn't join us today, but we want to acknowledge Stephanie Cole for mobilizing the regional discussion last year and supporting us address the regional needs and priorities. I will invite Lina to cover this summary on behalf of Europe. Lina, the floor is yours.
Thank you very much, Farah. We'll just very briefly recap some of the regional priorities emerging for Europe from Transforming Vaccination 2020. Some key issues around regional needs and priorities. Europe and European countries emphasize that it's important to use lessons learned from countries that achieve transformation of vaccination services to help drive forward change in other regions as well. It's important to foster undergraduate education on vaccination across the entire European region as well, in addition to training postgraduately. And supporting the entire European region in the adoption of new vaccination models is also important. The countries in the region have identified some challenges experienced in vaccination, such as turning pilot programs into nationally applied vaccination services, some regulatory obstacles that sometimes hamper policy change. And of course, this is really important as this program this year focuses on policy, as well as receiving the support needed to drive forward changes. Sometimes not enough support is needed. Some other lessons learned are about how pilot projects are great opportunities to showcase the added value of pharmacists in vaccination, and how expanding vaccination services can indeed improve uptake. Some other legislative enablers and barriers they have identified are very much dependent on national factors. However, linking success stories from other countries to the national context can help with bringing about change. So it's really all about collaboration and learning from each other. Patience and persistence are important since legislative change can take some time, and changes in government could both be a barrier and an enabler, and it's really important to identify where the opportunity lies. These were some of the priorities emerging from Europe, and we look forward to discussing some more in the regional roundtables later this program. Back to you, Farah.
Thank you, Lina. Lastly, we have the Americas, and our facilitator, Eduardo Savia, who's the president of the American Pharmaceutical Forum, sends his apologies. Thank you, Eduardo, for your support, and thank you for sending your notes. We will focus the lens on the transforming vaccination in the Americas, and I will deliver these messages today on behalf of Eduardo. So regarding the regional needs and priorities identified to transform vaccination, COVID-19 altered regular and national vaccination plans because of some budget restrictions or other priorities. There are needs to fulfill the gaps that has been generated, of course. In some cases, vaccination rates were needed to be improved. Again, pharmacists wish to participate of immunization programs in community pharmacies in several countries. In the Americas, however, each country has different context and perspective, and the challenges that were experienced in transforming vaccinations for pharmacists were different. Pharmacists do need to be trained in the Americas, and pre-graduate and postgraduate changes in education should be introduced to generate the pharmacist competency to deliver immunization services. Another outcome is that national regulations should be changed in order to recognize the possibility of delivering immunization services at community pharmacies. I'd like to share some lessons learned while transforming vaccination for pharmacists. Of course, it still exists as an important percentage of the population in the Americas who has not suitable information about immunization programs and their advantages. Immunization versus COVID-19 in the Americas offers a great opportunity to actually change the actual situation. Immunization versus COVID-19 will be available without a cost to specific groups like health staffs and people that are older than 65. Finally, some legislative enablers and barriers emerging in the region. The Ministry of Health is identified as the main enabler. To have some community pharmacies integrated into the national health system with a health role clearly defined. And last but not least, the dean of the pharmacy school or a qualified person on his or her representation or even the organization of pharmacy schools should be part of the national committee where immunization services need to be introduced. So with that, I would like to thank our speakers, our presenters, and our facilitators for supporting FIP to deliver this global commitment in transforming vaccination, whether globally, regionally, or nationally. If we can go next, I will hand back to Lina to walk you through these key outcomes.
Thank you very much, Farah. We are coming near the end of the event today. We are running out of time, but we just have a couple of minutes left to really present to you the Transforming Vaccination 2021 program. What is it and what does it entail? Transforming Vaccination for 2021 includes 12 events running over 2 series. The first series focusing on equity in vaccinations globally, the second series focusing on a regional and national perspective. And once again, really emphasizing these goals, 2 of which also align with my other programs of work. So managing this program for the next year in a row is really, really a great privilege. Farah, could you summarize for us what entails Series 1 and Series 2 very briefly?
Thank you, Lina. So Series 1, entitled Towards Equity in Vaccinations Globally. This series comprises 5 episodes, and it includes the opening event alongside 4 other events. It explores equity in vaccinations across the different angles of age, gender, literacy and education, and interprofessional unity and collaboration. If we can go next, in Series 2, which is sustainability in vaccinations regionally and nationally. This series comprises 7 digital events, including 6 regional roundtables, which will actually discuss and identify priorities for sustainable access to vaccinations throughout pharmacies, of course, around the world. The program will end with a leadership summit in which we present a commitment to action on sustainable and equitable access to vaccines through pharmacies. I'll hand over back to Lina to highlight and emphasize the outcomes of this program again.
Thank you, Farah. So summarizing once more, the key outcomes are the 12 digital events, including 6 regional roundtables towards the later in the year, as well as a leadership summit that Farah just mentioned. We will also result in a FIP global commitment to accelerating equity, access, and sustainability of vaccinations through pharmacies, as well as another collection this year, but this time a special policy-focused one that really once more captures the outcomes of the events and provides mechanisms and implementation support to our members to transform vaccination with a focus on equity, access and sustainability. As the final part of our event today, we'd like to hand over to Catherine for her final reflections as CEO of FIP.
Thanks, Lina. Thanks, Farah. Thank you to all our speakers. I think it's really important for us to remember the three core pillars of this programme that we start today. The access issue is fundamental to FIP. Our vision and our mission depends on it, as do the roles of all of our profession. And then shoulder to shoulder, equity across all those elements, and then sustainability will be explored in much depth, and also with your input we'll be able to cater to your needs as well. There's been lots of questions in the Q&A about training, about guidance, about learning from other countries. I would urge you all to look at the FIP website. We have the Transforming Vaccination webpage, but we also have an awful lot of resources, whether they be advocacy toolkits, letters that we can accompany you with to your ministers, and then access to training, which will be coming down the line. Thank you so much for your attention today. And I have one more thanks to make as well. Our work on the transformation programme is supported by an unrestricted educational grant by our colleagues at Pfizer, with whom we have a long-standing, highly professional and mutually beneficial relationship, and we thank them very much for sponsoring us with this grant. It enables us to be able to provide what we're providing to all of you, open access events like this, and then much of the toolkits that we can offer to our members in particular. So we thank you very much, Pfizer. Thanks a million.
Thank you very much for that, Catherine. And with this, we'd like to invite you, please, to the next event in this programme, taking place on the 8th of July at 1300 Central European Time. We will begin Series 1 with an event that focuses on a life course approach to vaccination, looking at all ages and stages. Please join us in this event. To register for this event and all other events, you can scan the QR code on screen using your mobile camera, or visit events.fip.org and pre-register for all of the events, or visit transformingvaccination.fip.org to view the outcomes from last year, but also keep on track with everything we're doing in the 2021 programme. Finally, to view all of the events FIP are delivering within this programme and beyond, please visit events.fip.org, and we look forward to having you with us this year on our digital events. With this, I'd like to thank everybody, my co-moderator, and all of the speakers today, and you especially for being with us today. Thank you so much, and we look forward to seeing you very soon. Bye for now.